is going to be phase or level 1 of the glute hip prep activation series that we will use. Now, these are all going to be isometric based, so depending on where you're at in your development, we'll start with some short duration and then eventually progress to some long durations for each position. But all these drills will remain the same throughout this level. So the first one is going to be a double hip banded abduction hold in this kind of floating 90-90 position. So what it's going to be, you lie on the ground like so. I have 2 bands here to get more resistance, but you want to have some type of big loop band right above the knees more than anything. You are then going to lie on your back. Now, the biggest thing here is you want to make sure you're keeping this rib down position. So your ribs are not flared up. You're in this rib down position here. This abdominal region is engaged. You're feeling not only the kind of six pack, but also the sides here as well. If you have trouble finding that, you can have a little bit of like a banded pull down, but if you can get this position like this, that's fine. So now from here, you're going to be up to this 90-90, and then I want you to bring your legs out to the side, create enough tension out so you feel this kind of outer glute working here. I don't want this to be a lot of front of the hip. It's not front side. This should be all this back glute here, and you don't want your feet turned in like this. They're not in. Your feet are in line with your knees, and you're pulling out to the side, and this is literally it. You are just holding this position for essentially the designated amount of time. Want to be at about 90 degrees here. We might get to a point where we go a little bit deeper, but for right now, this 90-degree position here works perfectly, okay? So that is position 1. So position 2 then is going to be a side lying hip abduction. So you are going to be lying on your side here. Bottom leg is going to be bent. You want to keep that lower core, or the abdominal region engaged. You're going to raise your leg straight up, and then I want it just slightly behind your body. Now, when you go just slightly behind your body, you are going to feel a lot more of this kind of side hip, which is your glute med, maybe even a little bit of the glute max, big glute in the back, but I do not want a lot of tension along this front TFL hip flexor area. So again, you're going to be here, head is resting, and you're just holding this position for a designated amount of time. Again, 30 seconds to a minute in this position, it's going to get tiring. You don't have to go all the way up. I would say go more mid-range more than anything. I don't want you down here, though. Get to that mid-range position, and you hold that there, okay? Next is going to be a fire hydrant. Now, the fire hydrant I see done incorrectly from a couple different ways, where it's a lot of low back and pelvic compensation versus just on the hips. So what that looks like is, let's just say I'm doing a fire hydrant on my right side. People will lift up, and now they're opening up like this. We don't want that. What I want, again, rib down. You have a little bit of a tuck in the pelvis, so a little bit of some lumbar flex position to isolate the glute a little better. So you're here, tucked underneath, and you're just raising out to 45 degrees to the side. So for you to just kind of see this way, raising out to this way here, and that's it. I'm just holding that there. Again, this should be all back side of the hip. I do not want a lot of front of that TFL. If you go up here and you get a lot of the front, keep that fire hydrant position, but just bring your leg back like this. So your knee is essentially in line with your knee. It's not above, it's not forward like that. So again, we're here, we're raising out to the side, and we're holding that there. Again, I'm not shifting over this way. I'm not arching at the low back. I have a little bit of that flex position, and I'm staying stacked over both my hands while I'm holding that position there, okay? So that's our fire hydrant. So next, we're going to do a split squat isometric hold. Now, for those of you that have a lot of just pinching tightness in the front of the hip when you get to this kind of deep flexed and maybe an internally rotated position, we want to be very mindful of kind of how we're really kind of putting you in this position. So from a split squat standpoint, I would say I want you in a relatively vertical, and you'll see why I say relatively vertical. So vertical position. So you're going to be down here. I don't want this back leg all the way here. I want that back leg right underneath you like so. So you do have a bit of a 90-degree angle here. This tailbone is tucked underneath you, so you're locking that pelvis in on that back side here, and then you're really just kind of dropping down to that position here. Now, ideally, what I want to be felt is in this back glute. Will you get some quad? Yes, but I want you to feel kind of sinking into this glute here. If you have a hard time feeling that glute, go ahead and just perform a little bit of a hinge forward like that, very subtly. I'm not flexed forward like this. I'm not totally arched up like this. I'm in a good position, and then I'm just dropping down here. This is probably about as far as you're going to be able to go. Most people, I am not going to have them go knee all the way down to the ground, okay? So you're in that position here. You're holding that. Again, you can see it's a little bit of unsteady position, and then you're going to come out of it. From a foot engagement standpoint, what I want you doing this barefoot. So you'll see, I want you to keep that foot flat on the ground. Think about you're screwing your foot outwards into the ground. But what it's not is, it's not screw your foot to the ground and come off the border onto that outside part. You're keeping everything engaged on the ground, but you're creating tension into it. Like you're screwing a jar off more than anything. That's what you're trying to think about creating from a tension foot standpoint at the foot, and then you're going from there. So again, you're in that position here, and then you're holding that, okay? The last variation is to be a cross or curtsy lunge. So some people do it with a really far back position like that. I don't want that. I want you to start with that foot is really going just behind the outer part of this foot here. So you're in this position here, creating that tension on your foot, and you're just dropping down. Again, this should be very much in this back hip here. If you are getting pinching in the groin, I want you to come out of it a little bit, or just really make sure you kind of alter your position. So bring that foot in a little bit. What I don't want is as you're going into it, you're kind of falling over to the side here. If you're getting a lot of outer hammy, that's because you're falling off to the side. So you want to find that position. Again, you're here, you're coming back down. If you have a hard time finding it here in the glute, give a little bit of a lean forward, but make sure you're not getting any pinching in the groin.